So it's a pleasure to be here again at the FTD Education Day. I'm very happy to be here with you. We've heard a lot so far about the latest studies in FTD research. And so we thought it would be helpful at this point to bring us all back into the room. We're always in awe and touched by the dedication to research that you all have, especially in the midst of all the challenges that are going on in your daily lives, and particularly now. So we thought, as we did this year, or last year, we thought it might be helpful to take a look at how you've been critical to the work that we're doing in the FTD unit. There are many steps along the road from care to cure. It involves different types of studies, observational natural history studies, from which we actually build behavioral paradigms that look at brain behavior relationships. And then from there, we try to use that information to identify potential interventions. And then specific targets for the interventions, develop new tools for diagnosis, and even pharmacologic treatments in clinical trials. How do we do this? Obviously through collaborations, not only with researchers around the world, but most importantly, with all of you, our family members, friends, caregivers, partners, and patients. The question though right now is, what does actually partnering in a time of COVID really mean right now? Can we really continue to partner in the way we've been in the past? Right now, we're all practicing social distancing and sheltering in place. How do we still contribute? Many of you have been asking that. What about all the information that you've contributed so far? Does this mean that with the interruption from COVID-19, we're no longer able to continue? And does that mean all of our past research is no longer usable? Is it even possible to continue, given that we don't know what the future holds? How can we possibly collaborate in research when we can't come in for visits as we had previously? This is the question we're getting a lot right now. So to answer that question, I think it would be helpful for us to take a step back and think, well, what does partnering actually mean? Does it only mean coming in for face-to-face clinic visits and research visits? And that's the only way we can actually be partners in research right now? I think the best way to answer this is to look at a concrete example. For many of you who've heard me speak in the past, I'd like to draw on a very special activity in my life, which is music and rhythmic movement to music, and in particular, dance. Can we use dance and understand partnering through dance, and whether or not we can use that as a model for the partnering that we want to do in research? Well, let's think about it. What does partnering in dance really mean? It means moving together with a purpose. And I think it's safe to say that we are still able to move together with a purpose. It just means moving in a different way. What else makes for good partnering? Well, I think of having an interaction and being able to communicate. Good partners communicate openly and regularly with one another. They share information. What else makes a good partnership? Knowing that there is responsibility and care. Do we care for one another? Are we responsible and ethical in the way we approach our research questions? And are we making sure that we're making the best decisions possible for you and your loved ones? Most importantly, what makes a good partnership, I often feel, is trust. Do we have mutual trust? Do you trust in your providers and your researchers with whom you're actually partnering to make the right decisions when it comes to their research and their clinical decisions when it comes to your care? And I think if you have those three pieces in whatever partnership you're talking about, then you can say, yes, we can partner in research even in this time, as long as we have those components to it. It's still feasible. So if we can continue to partner in research, how are we going to do this moving forward? Well, let's start with looking at how your participation in research with us has been thus far. What are we doing with all of that data when we were still seeing you in person? And how are we actually going to continue that work now that we're not meeting in person and then beyond? As you know, many of our studies are looking at the full range of cognitive functioning. Not only do we want to understand what is happening in dementia, but we also want to understand what's happening in the brain in the earlier stages when you have mild cognitive impairment, or even when people are not symptomatic or just about to develop symptoms, or even in normal aging. If we look at the full range of cognitive functioning, this can allow us to understand brain functioning better and potentially identify targets for treatment and intervention. It also allows us to understand that there's a lot of individual variability and to try to identify things that might make us a little bit more resilient or resistant to disease or even the impact of aging. You've all been coming in as caregivers and care partners to every year with your loved ones for their research visits and filling out numerous questionnaires about functioning, quality of life, and you've been sharing your stories with us. All of this is real world data that we then use to correlate with their paper and pencil testing along with the neuroimaging studies. What are those studies? Let's review some of that. Many of you have already participated in the Artful Lefties study, and that's been for several years. Artful is the Advancing Research and Treatment for Frontotemporal Lobar Degeneration, and Lefties is the Longitudinal Evaluation of Familial FTD. Over the past year or so, the investigators in these studies have been able to obtain more funding to be able to combine the two studies, and is now part of what is called All FTD, the Artful Lefties Longitudinal Frontotemporal Lobar Degeneration. And as you recall, this suite of studies is really to learn more about the spectrum of FTLD, to support development of new therapies, diagnostic tools, identifying appropriate endpoints for clinical trials, and really overall to continue to characterize FTLD patients and the clinical subtypes, looking at biomarker information as well as the cognitive and behavioral information there. In addition, we've been continuing along with another observational natural history study, the LEAD study, or Longitudinal Early-Onset Alzheimer's Disease Study, where we're trying to, again, characterize and understand those patients who have an earlier age of onset of Alzheimer's dementia. Many of you have also participated in our family study, where we're looking at how knowledge of familial FTD and its psychological impact, how those pieces of information may impact decisions, for example, to pursue predictive genetic testing. These are individuals who don't show any symptoms and may not even know if they're actually carriers of the genetic alteration that leads to FTD, but it's a very weighty decision that many of these individuals have to face. And so we want to understand what the consequences are potentially of pursuing testing versus not pursuing testing, what the impact of genetic counseling may have on these decisions. And now several other sites across the country are interested in incorporating our protocol into their studies. The goal here is really to try to better inform genetic counseling as genetic counselors working with individuals who are in these situations. We continue to work on developing new tools, low-cost tools for earlier identification of biological signatures associated with Alzheimer's disease. In particular, we're looking at measuring brain waves using EEG and examining that along with sleep architecture to potentially find a proxy for the pathology that builds up and ultimately can lead to Alzheimer's disease. We continue with our studies looking at affect regulation in healthy individuals. Why do we want to look at this? Well, it turns out that if we try to understand why some people may run away from a challenge and others may actually pursue it, what is the difference in those brains? What makes somebody run away from something that seems to be a threat, and others might see that threat as a challenge? And is that some sort of marker of a resilient brain or a resistant brain? Do motivational processes say anything about our brains and what that mechanism might be? We're also looking at superagers. What makes somebody a superager? Superager is a subset of older individuals, for example, 80-year-olds, who may look like 20-year-olds when it comes to performance on certain memory measures, as well as in their brain structure. Why do we want to study superagers? Well, if we understand what factors may actually contribute to making somebody a superager, could we leverage that into an intervention at some point in time and incorporate that into somebody's life to help them stave off cognitive decline, either associated with disease or more rapid aging than they would like that's not necessarily related to disease? So really understanding, again, the full spectrum of what makes a healthy brain and what keeps the brain resilient is really important in dementia research. And we were just wrapping up this year a meditation study, which in collaboration with Dr. Sarah Lazar, who's a meditation researcher, we've been trying to understand how this type of what some people consider brain training how this might impact the memory centers of the brain. How does this training impact connectivity in the brain, and how does it translate into performance on memory measures and functioning in daily life? Not only did we look at this in healthy individuals, but we started to look at this in individuals with mild cognitive impairment, trying to understand what the mechanism is. Another study that we were successful in launching this year under Dr. Aldayev's leadership is the non-invasive brain stimulation study using TMS, or transcranial magnetic stimulation. The idea here being that manipulating magnetic fields to stimulate nerve cells in the brain could lead to improvements in cognition. And in particular, we were studying the impact of TMS on language and memory in individuals with primary progressive aphasia and mild cognitive impairment. So with all of this data that we've been collecting all along, we've been working hard and now furiously analyzing all of these data that you've contributed while we're at home. As you can see, these are group meetings, very productive, many of us there. It feels as though we're working round the clock these days to try to analyze and make more sense of the data and really dig deep into it. So now I'm going to talk about all the ways in which we're continuing our partnership while we're working from home. And in parallel with these efforts, how we're going to move forward. So let's start with the caregiver studies. This is thanks in part to the efforts of advocates such as Katie Brandt, that there's been an increased interest in studying not only the direct impact of the disease on an individual, but also the additional impact on care partners and caregivers. And this year, we were able to expand our suite of caregiver studies to include the Resilient Together protocol with Dr. Erna Maria Ransonu. And we are hoping to help patients and caregivers through this protocol develop skills to manage stressors associated with having a young onset dementia diagnosis. Another study that we've expanded into is the Caregiver Video Intervention Study. This is an exciting one because this is a study that examines ways in which we can improve education for patients and caregivers about their condition and how this might impact advanced care planning and decision-making more generally in these very difficult journeys. Our goal was really to work with the community to better understand and determine their needs so that we can develop these patient and family-centered methods to teach people how best to navigate such complexities these conditions can bring. Interestingly, this gave us also an opportunity, especially in the time of COVID-19, to launch a sub-study where we're also examining how the needs of patients and caregivers may be impacted by COVID right now, and to specifically understand what COVID means in terms of decision-making and advanced care planning for patients and caregivers. Those two studies, the caregiver studies, are all being conducted right now and have been continuously conducted during the past 2 months, in fact, because they were designed to be remotely administered and remote assessments. So we've already been taking advantage of the video conferencing platform. As many of you now know, we're actually moving more of our work to these remote assessment platforms. Some of you have already experienced this, as our team has been working to bring the office examination and discussions to you through the phone and through video in a phased manner. And while we're collecting all of this information for your clinical care, we're hoping to validate this against your previous in-person visits, just to check to see that what we're actually capturing with you right now over video is going to be comparable and really what we want to be capturing had we been visiting in person. At the same time, we're working with companies in the community who can potentially help us reach more of you more frequently and more regularly. So we're testing out new platforms that can be deployed on your phones and your tablets, recreating many of the tests that you would normally take when you come in for your in-person research visits. The idea of pursuing these collaborations is so that we can start to see you and connect with you more frequently and regularly, in addition to those once-a-year in-person visits. This allows us also to capture more of that normal variability you all experience, we all experience, and it gives us much more information about what functioning is like for you on a day-to-day basis. We're also interested in capturing the observations, the reports of the symptoms that other people may be able to contribute. Similar to the way many of the caregivers in our studies are filling out questionnaires when they come in for their visits, certain apps may allow you to now enter all of this information much more regularly, and as you see changes happening day to day, if you would like, allowing us to track over time what the natural course and fluctuation may be for the symptoms that people are experiencing. So the hope is that with these new remote assessment options that we're developing and trying to make available to everyone, by the time we come, we get to see you in person again, and I think it will happen, whether it's in Charlestown or in clinic at the main campus, we will have been in touch with you during this time. And we're hoping to continue to be in touch in this very active and connected way. With all of this additional information, I think we're going to get a richer picture of who you all are and what you're actually experiencing on a day-to-day basis. This also allows us to understand the complexities of your diseases, but also to understand what really goes on in normal human behavior and normal daily functioning. We all think that our functioning when we're in the office is how things are in between office visits, but we know that there's a lot of variability. And so hopefully with greater connection with you in between visits, we can actually paint a much richer picture. And this, I think, is going to help us maintain our partnership with you in care. So the goal of all these studies, again, is really to understand what your brains, our brains look like today, how they're functioning, what kind of mechanisms are impacting our functioning, what mechanisms are preventing change, so that tomorrow we may be able to intervene earlier, and maybe at some point down the line, our goal is to actually intervene at a point where we're not even going to see any type of impairment or significant change that impacts life. Your contributions have helped us understand the brain across the lifespan so far. And even in this time, when it seems impossible to be part of clinical visits and research, I hope you see that we're working tirelessly to stay connected with you, even more so than you had been in connection with us previously. Hopefully we can make this type of connection the new normal. So when we come out on the other side of this pandemic, we will continue to use all these tools that you're helping us develop, you as the citizen scientists. So we continue to rely on you, as we always did, not only to be our educators and advocates, but to be the partners in science that you already have been. Going back to the first question that I asked earlier on, what makes a good partnership, and do we have all the components to continue to be in partnership during this time? Is there interaction and communication with the way we're setting things up now? Is there responsibility and care going back and forth within the community among us and your providers and you and your family members? And is there trust? I would say, and I would hope that at this point we can answer yes, we can create and continue to maintain a very strong partnership through all of these new modalities and new studies that you've all been so helpful with. So with that, I would like to thank you for continuing to partner with us in this dance we call community research. Thank you again.